This panel was recorded Friday, March 19th during the 2021 Public Administration Research Conference held at UCF, Center for Public and Nonprofit Management, within the School of Public Administration. This panel, titled COVID Chaos, Policy Prescriptions, Layered Safety, and Economic Risk Management, is moderated by Ms. Ruth Kessa.
Good morning, everyone. Welcome to Public Administration Research Conference. Before we get started, I have a few requests and suggestions for you. I advise you to keep your Zoom on mute, and if you have any questions, feel free to use the chat box for comments also. And if you have difficulty running your camera, it's okay to keep it off. I want to remind you that you are in Safety and Security Track Session 1, Panel A. Oh, by the way, my name is Ruth. I forgot to introduce myself. I am a PhD student from UCF. We have our topic for this morning is COVID Chaos, Policy Prescriptions, Layered Safety, and Economic Risk Management. We have three panelists this morning. Our first panelist is Ms. Titty Varghese, PhD student at Kaunas University of Technology from Lithuania. Her research is about fighting COVID-19 in Kerala and the role of local self-government. In Ms. Titty's research, she focuses on collaboration of state and local government, including some key stakeholders in the field of emergency management to prevent the spread of COVID-19 from entering the village of Panchayat. Our second panelist is Mr. Ruechagorn Trairatananusorn. He is a PhD student at University of Central Florida. His research is about best practice pandemic responses, at what cost, lessons learned from Thailand COVID-19 pandemic responses. In this study, Mr. Ruechagorn will discuss on lessons learned from Thailand COVID-19 responses under the system's perspective by elaborating on existing administrative capacity, economic context, and commitment of citizens' compliance in the pandemic response with possible trade-offs between public health outcomes and economic outcomes. And lastly, our third panelist, Dr. Ahmed Jamo, lecturer at Ahmadu Bello University, Zaria, in Kaduna State, Nigeria. His research is regarding public perception on government and non-governmental organizations on the control and spread of COVID-19 in northwestern Nigeria. Dr. Jamo will discuss about the effects of the lockdown in Nigeria and strategies employed by the Nigerian government to limit the spread of COVID-19 in Nigeria. Without further ado, my dear panelists, the floor is yours.
Thank you, Ruth. So maybe I will share my screen now. Can you see it?
Yes, I can.
Okay. So good morning, everyone. My name is Titty Varghese. I am a final year PhD student in Kaunas University Technology. My major is in political science. Today, I will be presenting mainly on the topic fighting COVID-19 in Kerala, the role of local self-government. The co-presenter is Mr. Vishnu Muralidharan, my colleague. So I will be mainly presenting the slides. I hope you can still see the slides, yes? Hello, can you see the slides?
Yes.
Okay. So I am actually dividing this entire presentation into three different segments. First of all, mainly speaking a little bit on the COVID-19 scenario in India, then what is Panchayati Raj institution at the local self-government level, then going to the specific case study of local self-government activities in South Indian state, Kerala. So Kerala is a South Indian state. The main methodology that I am using for this research is mainly qualitative content analysis, policy document analysis on Panchayati Raj institution, then governmental programs at the panchayats in Kerala state, and also for the analysis I have used MaxStudio software. Now coming to the point of COVID-19 scenario in India, as you can see from this figure, in India we have quite a huge number of COVID patients, and it is kind of really bad scenario. Approximately more than 10 million people were sick, and as you can see here, over 159,000 of people deceased. So in India, we have 29 states and 7 union territories. So it is really huge. Now, what is Panchayati Raj institution? From here on, I will be calling this local self-government as Panchayat. So as you can see, Mahatma Gandhi said that the soul of India lives in its village. So basically, his ambition was always to have good development programs and promotion and economic welfare of the society, and it should be starting from Indian villages. So in order to achieve this task, in 1992, the government of India implemented a new policy. It is known as Panchayati Raj Act. And based on the 73rd Amendment Act, it was established at the local self level. So this word Panchayat means, Panch means 5, Ayat is assembly, and Raj is rule. So basically, it is a council of 5 officials. And back in India, in the previous times, in a village, the elderly person was the one who is always, giving the guidance and advices to different people on different level of administration. But from 1992, we have Panchayat at the village level. Now, what are the important key factors or figures in the Panchayat administration? There should be a president, vice president, ward members, standing committee, and secretary. So they are the important 5 people in this entire system to be coordinating all the activities within a village, and also communicating directly with the state and national level. So this is the structure of Panchayati Raj institution. As you can see, there is the state, then we have below district level, then below that block level, below block we have the village level administration, and it is not village panchayat. For each level, there is a responsible person who is the president of this group. Below that, we have the ward. So let's imagine like this. In Kerala, Kerala is a state, and in Kerala we have 14 different districts, and in each district, at the district level, there is a president. Below that, there is a block level president. Below that, there is a village level president. And below that, there is ward members. So for each group, the ward member is the responsible person who should be taking care of all the activities within his neighborhood and communicating directly to the village president in relation with all kinds of development aspects and welfare schemes. So why Kerala? Kerala is a South Indian state which is closely lying near to the Arabian Sea, as you can see in this map. And Kerala tops one of the top states in India when it comes to different developmental indexes. And we have approximately 30 million population. Now, when it comes to the scenario of COVID in the state of Kerala, we were actually affected with the COVID scenario hugely. And at least most of the people got recovered, but still there has to be done a lot. And nearly 4,450 people lost their life in Kerala, just in our state. And the vaccination is going on at the moment. Now, coming to the main findings, what are the important policy measures at the local self-government, which means at the panchayat level in Kerala state is happening presently. So like I said, in one district, there should be minimum 35 to 70 village panchayats, except one district, which is known as Wayanad. It is quite, it's a big district, but in fact, the population is comparatively less, and also mainly it is mostly forest area. So the population is less, and therefore the number of village panchayats is also only 23. But in other districts, we have 70, 53, 65, depending on the size of the population. What are the important public policy measures that are actually implemented in the state of Kerala in the panchayat level in order to prevent COVID-19? So to prevent COVID-19 issues at the panchayat level, like I said, ward member is the important person who should be really responsible for whatever is happening within his region. So he or she is actually communicating directly with the people who are coming abroad and tracking and tracing their activities and preventing the contact. Apart from that, another important regulation is that we have private hospitals and public hospitals. In the public hospital, the treatment is quite free. However, most of the people always depend upon the private hospital as well. In this specific condition, during this COVID-19 scenario, the private hospitals are charging huge amounts. So in this case, in the panchayat, it is the responsibility of the president and other leaders to correlate this kind of huge charge and inform the state government to prevent charging too much money additionally for patients. So thereby, the state government implemented new policy at this time that, like for ward, it should be only 32 USD, and for ICU for 90 USD, and for ICU 159 and rupees 6,500 for ventilators. Ventilators are 159 USD. So this has to be there. Otherwise, private hospitals will be charging too much money from the poor people. So this is the sole responsibility of the local self-government to implement this policy very strictly and monitor the practices. Now, another important policy implemented by the panchayat is to break the chain campaign. Most of the people in different panchayats and different society really aware about the issue. However, there might be some kind of lack of coordination or following up the rules and regulations. So in this case, the panchayat authority is the sole responsible person to check if every ward member is following this regulation. So we have a very strong backup on the Break the Chain campaign. It is very successfully going on at the moment. Then at the panchayat level, the government established another policy scheme, COVID First Line Treatment Center, CFLTC. And this is basically for primary healthcare system. Since this is a scenario and normally if you are sick, people cannot go to the hospital. In this case, CFLT is providing special assistance to the needy people. Then we have approximately 41 CFLTC at the moment. Again, the CFLT team is actually providing food and assistance to the poor in the society as well as for the COVID-19 patients. We have another important organization in Kerala, which is known as Kudumbasri. Kudumbasri is a poverty eradication and women empowerment program implemented by the State Poverty Eradication Mission in 1997. So what they are actually doing is to help and coordinate different activities within the local self-government and support the projects of the local self-government. So most of the members who are part of this Kudumbasri is women who are married or sometimes unmarried and also women who are working. So in this case, Kudumbasri is actually supporting the activities of COVID-19 prevention project along with the support and financial assistance from the panchayat. Now, there is another important policy recently established, especially during this COVID-19 scenario, which is known as e-Sanjeevani. It is an online medical checkup. So that people who would like to go to the hospital and get a consultation do not really require to go to the hospital because it is prohibited at the moment. So people can actually sit in their own home and consult with the doctor without going to the hospital. In this case, not everyone may be, having the internet facility or maybe no idea on how to book an appointment time. So this is the time where this ward member or ward leader should come to help. which means if if I am sick and if I don't know how to do things, my ward member, who is the responsible leader of my area, will be coming to my home and book online medical checkup facility for me. And if I am not able to go to the medical store to get the medicine, this person or someone responsible from the panchayat will be providing me the medicine. So this is also very important policy measure when it comes to the prevention of COVID-19 at the panchayat level. So this is actually a field work pictures that I have collected in 2019 during my studies of research back in the state of Kerala. As you can see in these images, you can see that this is the president of the panchayat. If I remember right, I think she was the vice president, and these are the ward members. So for each panchayat, there will be approximately 10 to 15 wards, again depending on the geographical width of this entire region. But usually we have approximately 10 to 15 ward members. So which means if you are, let's say if you are from Florida, and then Florida is divided into different sub-regions, and for each sub-regions you will have one leader, and that leader will be the primary contact for you if you need any kind of assistance. Through this system, through this Panchayati Raj institution mechanism, government will be able to provide primary care to you, so that you don't need to risk any of your health or your family members' health if you need any kind of assistance. And this is also, this entire pictures is actually from Idiki district, which is similar to Wayanad, with a large population of people. At the same time, there are different regions there which are really remote and forest areas. So there are animals and different kinds of struggles to reach to that particular area. So in this case, these are the limitations of my study, which mainly shows that not every ward member or not every leader will be able to help and communicate with remote people if they need certain kind of assistance, because they are in the deep forest or really hard to reach to them. So this is the important study when it comes to the policy measures that are actually happening at the moment in the state of Kerala in the panchayat level. So as a conclusion, I would say that in Kerala, the strict policy measures to prevent COVID-19 is happening, and we are quite successful in that. As well as the community support is really good, and we have NGOs, church organization or other religious organization who are actively participating in supporting panchayat activities together with the society. And also there are increasing suicides at the moment because of depression and loneliness and lack of employment. So from the panchayat authority level itself, we have psychological support cell. So people can actually use that facility too. However, like I said, the limitation of this entire study or to implement this program is mainly accessibility to the remote area, then the low salary of the panchayat staff, then there is a limited facility for isolation. And when it comes to the women leaders, because we have 50% reservation for women and 50% of seat for men. So when it comes to the women leaders in the panchayat, especially during the night, maybe they need to travel alone, and maybe their husband's family, if they are married, they won't allow the woman to travel or do their duties in the night. So these are the important challenges that in a panchayat the administrative staffs are facing. So this is the main finding. Thank you so much. And that's it. I can stop sharing now, or yeah, thank you.
Thank you, Ms. Titty. Mr. Wu, you ready? Okay.
Can everyone see the slides?
Yes.
Oh, perfect.
Yes, thank you.
All right. Oops, sorry. Sorry, I have a little bit problem with my slides. All right, perfect. All right, good morning, everyone. My name is Ruechagorn. I am a PhD student at the University of Central Florida. And today we'd like to present my research, which is about lessons learned from Thailand's COVID-19 pandemic responses. And I will present you firstly a conceptual overview of this research, and then a conceptual framework, and then trying to lead on research methods and the case background. And finally, I will conclude with the lessons learned and discussions and future applications. So basically, from the existing literature of COVID-19 responses, recently, I think there are different focuses there. For example, public health focuses, and even in terms of the public administration, there are lots of different types and focus as well. But at the same time, what we could draw as a general conclusion from this literature is that the collaboration among policy stakeholders is the key for success response. But as you can see in the literature, most of them focus on the health-oriented responses rather than economic or social-oriented responses. And because the pandemic seems to be different from other natural disasters or emergency incidents, because, for example, if there's a hurricane in one area, you can also use supports from other states or other areas to help the damaged area. But in terms of this long-term pandemic, it seems to negatively impact almost every area. And that leads to extreme difficulties to gain supports or trying to cooperate with each other when everyone are negatively impacted too. And so this paper trying to provide some lessons learned from both perspectives, from both health-oriented and as well as economic-oriented perspectives from Thailand's COVID-19 responses. And the key argument here is that there are economic causes and administrative contexts that policymakers really need to pay attention in designing and implementing pandemic prevention and response measures. And so before I'm going to start the conceptual framework, this is a review from the literature, and mostly from public health literature. And as you can see here, the public health literature seems to focus on two measures in tackling pandemic. First of all, it's a pharmaceutical measures, which including antiviral drugs and vaccines. However, in terms of the new epidemic or pandemic, it's a low likelihood that we will have effective vaccines in hand at the new pandemic incident. So most of the measures seem to focus on the second one, the non-pharmaceutical measures, such as the screenings, testing, contact tracing, quarantine system, as well as social distancing measures. But at the same time, the public health literature seems to neglect the last one, the supportive measures, which are very important. For example, and I think especially in terms of the essential service operation and economic support. And in terms of economic support seems to be the new one because the major pandemic globally occurs 100 years ago. And later on, the pandemic seems to just, cluster in particular regions or countries rather than globally contagious like COVID-19. So in terms of the focus on economic supports seems to be very limited in the literature. And even in the official documents from World Health Organization, it just briefly mentioned it, that we really need economic support. But the document itself didn't say or state much about how should we do so. And this is the conceptual framework of this work. It's based on the World Health Organization's framework and in working to drawing lessons and trying to identify some key measures to trying to solve the pandemic. And these are based on the building blocks here. But in this work, I'm trying to revise it because it is much more meaningful to identify these into the simplified building blocks. For example, institutional governance context. Second one is the implementation perspective. And finally, this is a newly added one, is a citizens' responses. Because as you can see from the responses around the world, citizens' compliance and participation is very, very important for the success of the response in general. And so for the research methods, the research question here is what lessons other countries can draw or learn from government responses to COVID-19 pandemic in Thailand. So this study seems to focus more on the national level rather than the local level. But overall, there are some lessons learned from the local level as well. And this study used the qualitative single case study design, and for the data collection and data analysis, this study used the document research and thematic analysis. So basically, it's a triangulation from legal and official data and official documents, as well as the news reports, scholarly and non-scholarly literature. And based on the conceptual framework previously presented, the key theme will be the health-oriented response measures and economic-oriented response measures. For the case background, this seems to summarize almost everything here. For example, as you can see, the cases of the COVID-19, this is the last year, the first wave, which is quite small, and the second wave recently, early this year. And as you can see here, on the purple color, these are the response measures, health-oriented one. And in the terms of the green one, these are economic-oriented measures response. And the red one seems to be like the incidents or the super spreader clusters that occur during this time frame. And as you can see, first, before the major super spreader incidents in Thailand in March last year, the Thai government seems to be quite proactive in terms of doing the risk communication and screening protocol at port of entry. But however, that because of the super spreader incidents, the government just trying to escalate the situation and response by establishing the Center for COVID-19 Administration. And at the same time, it also implement several measures, including the comprehensive measures like nationwide lockdown for the whole month, and extended that to, I think, almost 6 months. And also the state quarantine for travelers and international travel ban in some countries as well. And later on, and it also enacted the emergency decree. And this is the key legal document that trying to centralize the power of the government to tackling the pandemic. And for the green one, you can see this is a huge economic response here. It's a 1.9 trillion baht loans for pandemic response to support health-oriented response as well as economic one. So as you can see, overall here, the confirmed cases are relatively limited comparing to major countries, and also the death as well. But however, there are also issues that I will present next. All right. So this is just some summary from my paper of the response measures, and this is the structure of the central of the special response unit here, the Center for COVID-19 Situation Administration. And as you can see, these operation centers are actually based on the central government's ministries, such as the Ministry of Public Health here, Ministry of Foreign Affairs, and so forth. So the structure seems to be much more centralized, and especially in terms of the implementation of these responses, the central government also including Ministry of Interior, which also control the provincial administration. Because in Thailand, we have 76 provinces, and 75 provinces, the governors are not elected; they are appointed by the Ministry of Interior. So in this case, you can see the centralized structure in terms of the response administration. And the lessons learned from the health-oriented responses, first of all, the institutional context and governance matter. Because first of all, in terms of the health governance and health system capacity, Thailand seems to relatively quite strong in terms of the capacity for the health system. It ranks 6th globally on pandemic response capacity, which is ranking in 2019. And in Thailand, we also have the free healthcare system, meaning if you get sick or curious about your COVID-19 symptoms, you can go to the healthcare centers or hospitals for free. And at the same time, because I think Thailand shares the similar experiences with some Asian countries like Taiwan, China, and etc., that we have so many pandemic experiences previously, for example, from SARS, from avian influenza, etc. So first of all, healthcare workers as well as the government seems to have some experience to respond on these incidents. And secondly, the citizens also have experiences to protect themselves. For example, using face masks as well as trying to comply with the regular health hygiene best practice. And also this, as you can see, it's a mixation between top-down implementation, technological innovation, and public compliance and participation. And for example, Thailand also implemented the mobile applications to track cases and quarantine travelers. And also in Thailand, we have this, which is called village health volunteers, who participate normally in general primary health care in the local village and local area. But in this case, the village health volunteers also involved in COVID-19 response by responding in risk communication, as well as the enforcing isolation and quarantine measures. But there's also lots of problems as well. For example, shortage of PPEs, and at the same time, there are lots of problems here. And however, in terms of the lessons learned in economic-oriented responses, the economic context in Thailand seems to focus more on the export, 70% of the GDP, and the travel industry, which accounts for 12% of GDP. And when we implement the nationwide lockdown, as well as the international travel ban, this impact a lot in Thailand with the 6.1 GDP growth minus, negatively. And as you can see here, the welfare system also fragmented in Thailand. For example, we have different offices that responsible for different types of economic relief programs, which are somehow discrepancies in terms of relief schemes. And at the same time, we also have the difficulties in implementing these as well. And in terms of the discussions, I think, first of all, Thailand's COVID-19 response measures are heavily skewed toward health-oriented measures and pay the huge price on the economic downturn. And secondly, the The majority of the economic relief measures are only piecemeal support and do not tie with employment protection like in the US or other developed countries, or aim at macro level economic development. And finally, COVID-19 seems to reveal the centralized administrative structure in Thailand and problematic administration. For example, in terms of the borderland management, as well as the illegal casino clusters. For the future implications, first of all, governance structures and administrative capacity are keys for effective responses. Secondly, policymakers should carefully consider the trade-offs between implementing extreme health-oriented responses and economic causes, and as well as should carefully think about its administrative capacity as well. And also, citizens' compliance and participation are crucial for effective response. And in terms of the future research, I think first of all, we could add more economic or social aspects into the pandemic response literature. And secondly, we need to study coordination between policy stakeholders at the national level as well as a local level. I think this is very crucial, and some of the scholars also already starting or have already done this kind of studies, but we need more. And finally, we also need to test the relationship between state-centric factors and social demographic factors. For example, it's not only government capacity as well, but also at the same time, there may be some historical development or something like the citizens' behaviors in general that may impact the COVID-19 response and the success of the outcomes. And yeah, this is just my presentation. Thank you.
Thank you so much for your presentation, Ruechagorn. We have our next panelist, Dr. Jamo from Nigeria. Dr. Jamo?
Yes.
The floor is yours. You feel free to share your screen for your presentation.
Can you see my PowerPoint, please?
Hello?
Hello, can you see my PowerPoint?
No, not yet. You have to share your screen so we can see it. You can click on the share screen. It's in green.
Yeah.
Click on this button and it will give you access to share the PowerPoint slides. Okay, yes, we can see it now.
Sorry for joining late, please.
No worries, you're fine.
Thank you.
Sure.
My name is Idris Ahmed Jamo from Ahmadu Bello University, Zaria, Kaduna State, Nigeria. The title of my topic is Public Perception. Public perception of government and government response and spread and control of COVID-19 in the northwestern Nigeria. First, the work is divided into 4 sections. First, the introduction, the methodology, and the literature review. First, the statement of the problem. Since the emergence of COVID-19 in 2019, there have been increasing challenges across the globe. These challenges include deaths of millions of people across the globe. It has also imposed multiple challenges such as uncertainty and difficulties, collapse of business, health financial crisis, loss of jobs, and hikes of prices of commodities, public distrust, resistance, and measures. As a result of that, different governments across the world employ different strategies so as to curb the impact of COVID-19. Such strategies include the lockdown measures, which include the closing of all works, businesses, and other activities, border restrictions, palliative measures so as to reduce the impact of COVID-19 people. Other government also rely on public sensitization of the public dangers of COVID-19 and how to control the spread of COVID-19 among the public. Other measures include the increase in our budget of the health sector so as to curb the spread of COVID-19. Others include, so the lockdown has serious repercussions on the general public, especially in the developing countries like Nigeria. The lockdown has increased the current situation and the livelihood of many people. To reduce the impact of lockdown, to reduce the impact of the lockdown, certain palliative measures were employed. This includes the increasing of money or budget on the health sector. Others are increased government plan to spend about 500 billion, which is equivalent to 1.2 billion naira or $1 billion as COVID-19 intervention measures. Others include plan to spend 50 billion naira, which is equal to $163 million by COVID-19 on the public. Government also received several donations from foreign and national NGOs. The government also received donations of 43 billion from individual and corporate bodies within the country. There was also direct food and cash distribution by the federal government to vulnerable people. Other palliative measures to businesses include creation of 50 billion credit scheme for household and small medium enterprises, provision of 100 billion credit support to the healthcare industry, provision of 1 trillion loans to boost local and cultural services. There was expectation that with this effort by the government and the public sensitization, most of the people's attitude toward COVID-19 will change. But studies indicate that there is different perception on the government and COVID-19 itself. It indicates that there are different perceptions on COVID-19. There are also allegations that distribution of palliative measures. There are also allegations about COVID-19 index cases, increasing index cases in Nigeria. This study proposes to examine public perception of COVID-19 and government palliative measures in Nigeria. It is based on this background, we intend to find out what are the public perception and government response to COVID-19 in northwestern Nigeria. Specifically, we intend to find out what are the public perception on COVID-19 in northwestern Nigeria. We also intend to find out what is the level of public trust on wellness measures and NGOs on COVID-19 in North Nigeria. What are public response or responses on Nigerian government toward COVID-19 related measures in northwestern Nigeria? These problematic questions will serve as the basis for this research. To achieve this, we intend to use survey research methods in order to obtain data related to this research. The population of the study will be drawn from a sample of respondents in 3 states out of the 6 states in the geopolitical zone of northwestern Nigeria. 3 local governments will also be selected from each state in 3 state samples in our study. We intend to draw our sample size from Yamani's formula, which is n is equal to factor n 1 plus factor n. H squared. Use both primary and source of data. For the primary source, we intend to use questionnaire to elicit response from the members of the public. We also intend to use those open and ended questionnaires so as to obtain data from the public, so as to give them opportunity to express themselves beyond our patients. We also intend to use oral interview and focus group discussion with the staff of Ministry of Interior Affairs and Disaster Management. We also intend to contact staff of the NCDC, other health personnel, religious leaders, and traditional leaders. For the secondary source, we intend to review some journal publications related to the topic, as well as unpublished materials and newspapers. This will be accessed from internet libraries and office. The scope of the study will be restricted to northwestern Nigeria. The choice of the northwestern Nigeria is because of the long resistance to global health measures in the northwestern Nigeria. The scandalous field trial of either vaccine, which led to the death of millions of children, poor healthcare system in the region. The action to religious clerics and members of the public in the area. Research will also cover the period of 2021. The period represents the era of emergence and spread of COVID-19 and the increasing needs for action to the pandemic. The study will also concentrate on public perception, government responses to control and spread of COVID-19. The significance of the study is that COVID-19 pandemic is among the issues that have attracted global concern. As such, there's a scholarship contribution, especially in the developing countries, where they have lately contracted the pandemic. The research is also at the bulk of the existing few studies conducted of COVID-19 in North America. Findings of the research will also specify whether government and NGOs COVID-19 palliative measures have reduced public suffering amidst of the pandemic in the North. Literature review. Nigeria is the most populous country in Africa and the largest black nation of the world, but the majority of the people are suffering from lack of health services because of the weak health system of the country. And so Nigeria is vulnerable to COVID-19. Evidence of this is the increasing index cases of COVID-19 in Nigeria. The study reviews some literatures related to the topic. Study of Olurebe is based on the perception of government and its institutions COVID-19 pandemic in Nigeria. The study only concentrated on the literate people in the higher institution, neglecting the majority of the public. Therefore, this research intends to fill this gap by involving or by contacting members of the public to hear their views about or their perception about COVID-19. While research of Erenga on COVID-19 in Nigeria, though it's an empirical research, but the federal government it's concentrated on the study found that government palliative measures was trailed by politics. So this research is empirical, and it revealed that the palliative measures of the government was trailed by politics. So this research will concentrate on only northwestern Nigeria. Always saying study in 2020 use internet to measure the level of COVID-19 knowledge, attitude, and practices among Nigeria. The study found that respondents practice proper preventive measures and shows positive attitude toward foreigners. The study expressed attitude of educated Nigerians, but ignored majority of Nigerians who do not use internet. So this research intended to fill this gap by contacting the relevant institutions and members of the public who cannot use internet, who cannot access internet all the time. This research will add more value to the existing literature. It will also guide policymakers, NGOs, and public perceptions on COVID-19 related issues. Method of data analysis. This research, the data gathered in this research will be analyzed using qualitatively and quantitatively. Qualitative data will be analyzed thematically, while quantitative data will be analyzed using correlation tests. Correlation test is a very powerful tool for explaining the relationship between variables. It's used also to understand whether a relationship is positive or negative. Also, it shows the strength of the relationship between variables. Thank you for listening.
Thank you, Dr. Jamo. Now the floor is open for questions. You can stop sharing your screen if you want to, Dr. Jamo. If you have any questions, feel free to type them in the box or any comments that you may have, or you can feel free to speak out if you want to.
Hello?
Yes, can you hear? Yes.
Yeah. Please, based on my presentation, you can see that my work is incomplete. It's just
Right.
like it's a proposal.
Yeah, it's in progress.
Yes, it's in progress.
Mm-hmm.
I don't know that the listeners can add more value to this research, whether they can advise me on how to improve this research. I know that there must be a pitfalls here and there. I don't know that there are more inputs here and there.
Right. May I ask you a question, Dr. Jamo?
Yes, ma'am.
Why did you choose this methodology to answer to your questions? Why you think they are the best fit to answer to the questions that you're trying to, the issue you're trying to understand?
First, I intend to review first the literature to see what's the views of other scholars related to this topic. Second, I intended to interview relevant institutions, people, the staff of the institution of health sector, religious leaders, the traditional rulers, which I consider them as stakeholders in COVID-19. Because religious leaders, there are some religious leaders in Nigeria who are not comfortable with this COVID-19. There are people who are not even they don't agree that there is an existence of COVID-19. Also, there are some people who have different perception on COVID-19. This is based on preliminary investigation and found. So the traditional rulers, they are the people who are the most closest people to the local people. So they are in better position to know the situation of the local people. So I think if I interview them or I organize a focus group discussion, they will be a valuable source of information to me. So also the local communities. I intend to contact them because if you look at most of the research, previous research, they concentrated most on educated elite, neglecting the local people within the community. by contacting the local people within the community, I think I can get at this time information directly from the people, from the source. I don't know that you get me right.
Okay. So what motivates you to do this research? And what are your major concerns?
What motivated me most is, since the emergence of COVID-19 pandemic, there are different reactions, particularly in Nigeria. Some people are of the view that it's a kind of design or calculated attempt by the West to populate the Africans, or mostly some Asian countries. So I think usually issues like this, especially immunization, in the previous years there were strong resistance on immunization in Nigeria, particularly this polio vaccine immunizations. So based on this, I found it very interesting to conduct research on this issue because it's one of the relevant issues. It's one of the issues that is kind of people are interested to know what is the reality about it. So I want to know how people, the extent to which people perceive this COVID-19. And also, there are also allegations that the palliative measures which governments designed to reduce the sufferings of local people are being trailed by politics. So I intend to find out whether this allegation is true or not, or if it is true, to what extent, to what is the levels of such allegations. Yes.
Okay. I have another question for you. What are the non-governmental organizations working with the Nigerian government?
Oh, the non-government, yeah. Yes, there are like units. Hello, are you hearing?
Yeah, I was asking what the non-governmental organizations.
NGOs like yes, like UNICEF and World Health Organizations. Yes. So I intend to look at what are the public perception on these organizations. What are they perceiving toward health issues in Nigeria, particularly COVID-19 pandemic.
Okay, thank you. Does anyone have any questions for Dr. Jamo? Okay. I have a question for all three of you. If the audience doesn't have any, or if they were already thinking. Okay, while thinking, let me ask this. Based on the observations that you made, what are the implications of your research today?
No?
Yes?
Are you referring to me?
Yeah, to all of you. Yeah.
The implication of my research today? Hello?
Yeah, I can repeat the question again. Based on the observations that you have made, what are the implications of your research today?
Can I start first?
Sure.
Oh, you first, Titty. It's okay.
No, it's okay. You go.
Oh, okay. Thank you. I think I have already presented one, but I could quickly summarize it. I think there are two. First of all, no. It could be both academic and also for the practitioners as well. I think we really need to think more about our government structures, administrative capacity, and the context, because not different countries may have different contexts, And at the same time, we really need to be very carefully in terms of implementing the extreme nationwide lockdown policy, because it's good in terms of healthcare perspective, but at the same time, it has causes as well. So it's how to say, I think it's a key to balancing between the health-oriented measures as well as the economic-oriented measures. So I think this is the key implication from my work. And in terms of the future research, I think we really need more research in COVID-19 responses, and including more than health-oriented research, because at the same time, recent public administration literature seems to focus more on the health care perspective. But we really need more other perspectives to adding the insights and adding to the literature of the pandemic response as well as the emergency management response as well. Yeah.
Thank you. Go ahead, Titi.
Okay, so in my case, like I have already discussed, this Punjabi Raj institution policy is a very good policy because it is helping the community development from the grassroots level. So in many countries, when it comes to the equality and exchange of the ideas and supporting system, it works in different way. In the case of India, since we have more population, sometimes it is hard for the state government to directly come and provide the assistance to the needy people. So in this case, this panchayat level, grassroots level, bottom-up kind of administration is always supporting the needy people. So if I am the leader, I know my locality, I know all the people in my place, and then I am responsible for them, and then I communicate with them directly and inform the higher level authorities on what they require. So this is the major important implication of my study. So in the future, definitely the practitioners, especially the politicians, as well as the district administrative officers will be definitely able to get to know the important policies, changes, and allocating different financial assistance to the concerned villages when it is necessary. So it is like a coordinated accountability system for disaster management, especially like this scenario. So this is the main implication of my research. Thank you.
Dr. Jamo, is there anything that you would like to add?
Okay, the implication of my research is that after conducting this research, I'll come out with a finding I'll clarify whether or not people have, I'll come with the evidence whether government palliative measures has reached local people or not. Because there are now allegations from the palliative measures has been trailed with politics. So based on this assumption, after conducting research, I'll come out with findings, and it will show whether palliative measures has reached the vulnerable people or not. And it will also clarify the public perception on the health measures, such as health institutions like World Health Organization, UNICEF, and other non-governmental organizations. I will clarify this. The study will clarify whether people have positive perception on those institutions or not, and it will also help government to understand their policies, particularly on health, whether it affects people positively or not. This is not, I think, supposed to be the application of my research.
Thank you. I want to remind the audience that the floor is open for questions. If you have any, you can unmute yourself and ask the question, or you can put them in the drop box. Feel free to either speak out or type. in the chat box your questions. I have another question for you. For all three of you. If you would conduct a new COVID-19 research, what would you do different? And would you use different approach to the pandemic? Or would you use the same methods?
Please, I don't get this question. Sorry.
Okay, the question is, if you were to conduct a new research on COVID-19, what would you do differently? Would you use the same approach? Would you approach the pandemic the same way? Or would you approach it different way? Or would you use different methods?
I guess I can go first.
Sure.
Yeah, because this research is just part of my dissertation. So this research is just the expansion version from the context chapter, if you like. So I am actually going to do different methods because my dissertation is focusing on the relationships between policy stakeholders in COVID-19 response at the provincial level. So I will use the social network analysis and also doing some interviews from the policymakers at the local level and trying to mix the both data and analyze them. And I think this is just one way to do the COVID-19 response research. And I think there are lots more to do in the future as well.
Thank you. Go ahead, Titty.
So in my case, I'm actually focusing on the Punjabi Raj institution policy for my doctoral dissertation, and it is already in this finalized way. And I could definitely use the primary data collection for future research on this specific theme. Since the policy implementation is going on at the moment, definitely there has to be done a lot for the future research. So based on my understanding, I believe that it is really essential to identify what are the different lessons that we can learn from implementing these programs at the state level as well as at the panchayat level. And also it is possible to identify what are the important challenges that they face during their implementation process. So these are the important key themes that I could explore for the future research by identifying the primary data. So I think this will be really helpful for other states as well, since Kerala is actually like a role model for other Indian states when it comes to different policy implementation. Yeah, this is the main key factor.
Right. Thank you. Go ahead, Dr. Jamo. It seems that you raised your hand.
Yes, so my research intended to look at public perception of COVID-19, public perception on palliative measures, government palliative measures. I can also reverse the barrier to look at what are the government impacts on public, how government efforts affected the level of improvement in the healthcare system by looking at the indices of COVID-19 in Nigeria from 2019 and 2021. What has government sensitizations did on the public? Has public understand what government trying to sensitize them? What is the level of public sensitization? Whether it has improved the levels of health sector development in Nigeria or not. I can also look at the level of acceptance, public acceptance, whether they have accepted the the public, the government sensitization on what is the level of public trust on that sensitization program. I don't know whether that means. So I'll only look at the variables to change their relationship, whether government sensitization program has improved or has impacted most on the level of healthcare service delivery. What are the impact? Has it impacted most on the level of healthcare service delivery or not? These are the variables I think if somebody can conduct research on this.
Okay, thank you. I want to remind the audience again, the floor is open for questions. If you have any comments or any suggestions, feel free to unmute yourself. And Dr. Jamo, his research is in progress. It's not a complete project. So if you have any suggestions for him, anyone, feel free to comment. I have a question for each of you. Let's start with Dr. Jamo first. In your research, you have stated that that Nigeria, they use lockdown as one of preventive measures to prevent COVID-19 from entering to the country, and as also a measure to prevent it from spreading, the spreading of the virus. So why do you think the lockdown was the best strategy for Nigeria to prevent the spread of the COVID-19? And do you think that there are other measures that the government could have used instead of the lockdown?
Okay. To me, I think there are some other measures which government, if our government used it, it would have reduced the sufferings of the most Nigerians. For instance, the preventive measures like using face masks, using hand sanitizers, and social distancing, and allow people to go to their work and other businesses. Because most of the people in Nigeria are poor. When you look at the world ranking of poverty, and most of them rely on day-to-day activities. Most of them rely on informal activities, or informal businesses. Therefore, when you lock some people down, when you just allow them to go and get what the means of survival, it will add repercussions to their existing problems. Nigeria has been suffering from poverty for quite a long period of time. And when people are locked, other diseases such as malnutrition and other cases may tend to increase. I think if had government used other measures such as to allow people to go out for their work, but to maintain social distancing and to use face masks and to use hand sanitizer in public places, I think it would have reduced the increase of COVID-19 pandemic within the country, and it would have also reduced the sufferings of the majority of Nigerians. But to lock people in their own houses without giving them means of survival is another pandemic also. I think it has also increased the sufferings of many Nigerians. Government would have used another measure so as to tackle, not only to tackle the spread of COVID-19, but also to reduce the sufferings of many Nigerians. But when you look at the index of COVID-19 in Nigeria, it's not as high as many countries. Even though Nigeria have a weak healthcare system, but the lockdown has increased the difficulties which Nigerians have already been in existence since before the existence of COVID-19. I think the government would have used another measures to tackle the problem.
Okay, thank you. My next question is to Ruechagorn. If you were part of the Thailand government making decision, what other measures would you implement to prevent the spread of the virus, and at the same time to keep the economy going?
Oh, I think this is a tough question. um, I think based on my data analysis here, first of all, um, how to say, there are different things to do. First of all, I think we could um, copy from the best practice in Taiwan, which is a smaller country, and that their experiences is very good because first of all, they also have a same data access as Thailand. They know very early that the COVID-19 pandemic is happening in China. So their first response is that they trying to heavily screen and finally ban the international travel from the Hubei province, which is the epicenter of the pandemic, and then they later on ban the international travel from China at all. So this helps a lot because when they already implemented that, and finally the outcome is very good for them, and they can how to say, let the economic activities run very effectively in their own country. And I think this is the first lesson that every country can learn from Taiwan, not Thailand. And second one is that because Thailand also copy the nationwide lockdown model as in China, and I think this is quite problematic because I think in China they have substantial resources to do so, but in Thailand we don't have resources enormously to implement a lockdown nationwide, because once we did that, the economic downturn is how to say, the economic downturn is the huge cost for the nationwide lockdown measures. So the second wave recently in January this year, the government trying to copy the tier-based lockdown as in the UK. So basically, they how to say, they identify 4 or 5 provincial categories. The most severe one to the lowest risk tier. And I think that makes more sense because in some provinces that the cases may not be clustered, they can open economic activities there. But at the same time, with the severe impact areas, yes, we could do some limited or some lockdowns in those provinces. I think this could prevent the much more economic causes that occur in Thailand. And because Thailand also extensively dependent on travel industry, and I think Thailand should implement the travel bubble in some provinces, because in some provinces, for example in Phuket, it's a huge island and it's a good travel destination for foreigners. I think this area could be the, how to say, the pilot project for implementing travel bubble with other countries which has how to say, low cases of the COVID-19 in their country. Or at the same time, they can also implement several ideas which should be implemented earlier. For example, in Thailand now we implemented yacht quarantine, we implemented golf quarantine, for example. And basically it's a 14-day quarantine, but instead of the hotel, they moved to beyond into the resort, the golf resort, as well as the yacht for some folks. I think this is very interesting, but at the same time, it seems to be quite late to be implemented there. So I would suggest to implement it earlier and to see if the pilot project succeed or not. And if it succeeds, it can raise more confidence for not only the citizens, but also the foreigners to invest and as well as to travel. I think that will help a lot in terms of the economic costs. Yeah.
All right, thank you. And the last question is for Ms. Titty. Ms. Titty, how would you measure the mitigation measures adopted by Kerala? I'm saying it wrong. Kerala. Do you think it is? Do you think it is effective or not? If no, what would you do differently?
Thank you, Ruth, for the question. Actually, when in terms of India, the first case of COVID-19 infection reported in the state of Kerala in January 27, 2020. So it was actually, a couple of students are coming from China and then they were sick. So from there on, we had a huge number of increase of COVID-19 patients. In terms of NGO strong activities, we do have really good policy strategies and support from NGOs from different parts of the state, but they are collaborating with the panchayat at their locality. So which means when someone is actually coming from abroad and then from the airport itself, the panchayat representative is sending certain kind of official representative from this NGO, and they are providing the assistance and shelter facility for this person directly from airport itself. So there are different mitigation plans. Since this is like a very cautious scenario, and if they are actually going straight away to their houses and the entire region should be in the quarantine, so in these cases NGOs and other community organizations are strongly associating, and they have their own facility, accommodation facility. And the Kudumbasri, like I said, this organization initiated for and the eradication of poverty, but most of the heads are women and they have the community kitchen facility. So through this kind of different sub-organization, people will be able to get the food as well. So in terms of all process, I would say that in Kerala, the COVID-19 mitigation projects are quite well in compared to other states. Of course, there are challenges, like, in the case of local self-government, where most of the time women and men are always supposed to be with their telephone, and we don't know, because I saw my own eyes. I was sitting in this panchayat office for hours for interview, and then in 1 minute they will get really a lot of responsibilities, and they are trying to manage everything all together at the same time. So this is one of the important challenge. They don't have any rest, the people who are working at this panchayat, but they are really happy to help the society. However, there are different challenges, especially from the socio-cultural background. When it comes to the patriarchal approach of the society, if there is a woman leader and if she need to travel even in the midnight, to give some help to the COVID patient or some assistance, she need to be there because she is the leader. So in such cases, she must have her husband or someone from the family who can accompany her. So there are different kind of cultural associated complications also. So but basically NGOs are supporting and having a very strong coordination with the panchayat. So these are the important measures. So I really believe that it is working.
Right. Thank you so much. Thank you to all our presenters. It was good to have you all this morning, and thank you to the audience. Is there anything that you would like to say? Anything you would like to add before we end this session? Anyone from the audience? Okay, hearing none. Thank you so much for your time, and we have other sessions going on. Feel free to join other topic that might interest in you today. Thank you again for your time, and have a great day.